Clinical Skills Cabinet at the Medical Faculty, Banja Luka University, was established in 2013 on the initiative of the Nursing Department. It was equipped with the Strengthening Nursing in Bosnia and Herzegovina Project. In close cooperation with the project, the curriculum for the nursing study program was revised and harmonized with European Union directives and implemented since the 2016-17 academic year. Key changes are increased number of clinical training hours and clearly defined students' exit competences. As we all know, good clinical practice is based on the students worked directly with the patients. But today, things are different. The student has to talk to the patient, to see them, feel them, hear them, and touch them. The way things are done now is different. The patients are now better informed with the development of IT technologies and have better access to information. Their opinion is appreciated, it is respected, and they equally participate in the treatment decision-making process. However, they are less and less willing to take part in the training process. Within the project, clinical skills cabinets have been equipped at other 7 nursing faculties, and the cabinet staff trained to handle the equipment. What is important to point is that the Clinical Skills Cabinet allows students to perform in the real work environment specific and complex tasks, simple diagnostic and therapeutic procedures, and nursing interventions using the software provided by the highly sophisticated models. Also, it is very important that the students obtain feedback on their knowledge, skills, and the way in which they have performed a procedure. That can be obtained by the software and the light indicators in the cabinet, the mentor who checks every step of the procedure performed, and through debriefing. As you can notice, we work in small groups of 10 students at the most. Every student has a model on which a certain intervention can be practiced for several times, until they reach the appropriate level of competence as specified in the Clinical Skills Catalog. The Clinical Skills Catalog clearly defined the procedures that we need to perform and learn. It is easier for us to take the practical exam to avoid learning less important things. The Clinical Skills Cabinet provides an opportunity for us students coming from high schools other than nursing and is of great importance. The sophisticated models enable us to perform procedures repeatedly so that we can achieve the level of skills required for access to the real patient. The Clinical Skills Cabinet is our haven, where we are able to perform procedures on highly sophisticated models. As nursing high school graduates, my colleagues and I are able to master the procedures learned. The way we approach the patient after establishing that the patient has no septum deviation and there is no obstruction in the nasal corridors is that we take the probe of a certain size. You can demonstrate now. How you know how long the probe should be? We will know the length of the probe by measuring the length from the nose root to the earlobe and to xiphoid process. Then we mark the probe and then we start with procedure.